Young Miss Jamie had a farm, E-I-E-I-O.
Oh, Eric, no.
All right, fine, all right. You take the intro then, Jamie.
All right, so join Eric Miller, registered nurse of nearly 20 years with 50 jobs, an adjunct clinical professor, and today's honored guest, me, Jamie Clark. I'm told nurse on the top, farmer on the bottom, or one of the two, and be ready to have your life uplifted so you can in turn uplift others. Welcome to the Feeding Our Young podcast, recording live from the Rusty Truck Ranch.
Welcome to the Side B experience of Jamie Clark's episodes of the Feeding Our Young podcast. Thanks for having fun with me, Jamie, on that intro, as we like to do here. I said, to be fair, I said, Jamie, why don't you just sing a quick little rendition of Young Miss Jamie had a farm? And she's like, I am not singing. I was like, all right, fine. I'll put myself out there then.
I know.
Sounds good.
I heard Allie break into song on her episode, and I was like, that is brave. There's no way I would do that.
No, and I can't, like, karaoke's not my thing. No, thank you.
Me neither.
You want people to stay in the restaurant or the bar. I'm
Correct.
not the one to take the mic, so.
Correct.
All right, well, let's just get right back into you and your life here. But before we dive into the rest of your career, as I have tantalizingly promoted at the end of the first episode. First of all, again, if you guys haven't listened to her first episode, go back, listen to that. It provides a great foundation here for episode 2. But let's get to know you a little bit more by asking the question that I loved your prompt, the answer that you gave to this prompt, which is, who is your hero?
Yeah, so I thought about that a lot, and I don't think I've ever really had even like a hero in life. So I think that there's a lot of people that have like idolized certain people. I definitely felt like my sister was like somebody that I really admired. She's 11 years older than me, so she's kind of like, she's a little bit like half mom, half sister to me, because she's, we have that good age gap. And she's also a nurse. And so she just is like very strong person that I've always admired. But honestly, I kind of have always had an idea in my head about like who I wanted to be, or who I thought like what a strong person looked like, or what a strong woman looked like. And so I think I've always kind of had this like archetype built up in my head of being like somebody who is like willing to speak up and speak out, who has a strong sense of like honesty and respect and compassion for other people. And I think that all kind of centers around hard work in life. And so those are the things that I've always kind of had in the back of my head as like a foundation of who I wanted to be. And I think having grit in life can't be underrated. Like you have to overcome challenges and struggles, and you cannot hide from those things in life. Like you just have to kind of power through and muscle down and get through things. And I think that was definitely reinforced in nursing school, where you're just like, well, the only way out is through. So like, here we go, So that was definitely something, you learn a lot about yourself in nursing school because there's a lot of challenges. Yeah. But I think in nursing as well that, you run into these morally challenging or ethically challenging positions. And if you don't know who you are, it's very hard to handle those in an appropriate way if you're lacking like a stone of character. So I think that that's something that I've always tried to like fall back on when I run into hard situations where I'm like, gosh, this isn't right, or I'm super upset about this. Like, what should I do? I kind of reflect on like who I am and what I want to do for this patient in order to represent them properly, or speak out about safety concerns or whatever. And so that's sort of when I think about like being a hero, or not being a hero, but like what a hero looks like, or somebody who inspires me. Those are things that I think are foundational for hero types in life.
Yeah. Very much so. And very well said. For what it's worth, from the outside looking in, like when I think of Jamie Clark, when I see Jamie Clark, and I know I speak on behalf of many of my peers, like that's who we see. We see that perfect blend of like strength and willing to speak up and willing to speak out while balancing that out with compassion and care. And there are some nurses that maybe don't start out losing one of those along the way, but along the way, you either, you know what I mean, just put the head
Yeah.
down, get the work done, and you care for your patients. Or the flip side of that is you become this like strong, outspoken
Yeah.
nurse who
That
then
is very kind
loses
of
a
you,
bit of that
Eric.
compassion. Oh,
That is very kind of you. But I feel like the longer I'm a nurse, the more like sensitized I've become to like injustices in healthcare. Like there's lots of
mhm.
people that I feel like get jaded by it, that they're like, oh, like, that's just the way it is. And I think I was more willing to accept what the status quo was when I was a new nurse, because you're just kind of underwater and you're trying to keep your head above and you're trying to figure it all out, and you've got like you're trying to just function and take care of the patient, and then at some point you're able to like get fully above water and see land ahead of you and see what the big operation looks like and what everything is going on. And it just, yeah, it's like been very eye opening. I think especially over the last probably like 5 to 7 years, I feel like I have like very little tolerance for people to being unkind to patients, for
Yeah.
not listening to patients, um, for being too busy to handle something with a patient who is just downright concerned or anxious or whatever. And so that is something I think I'm getting like almost worse at dealing with, like internally. I'm like, I can't keep it in. I have to say something.
Yeah.
So, which is a whole nother set of issues because you tend to rock the boat more, right?
Uh
Like,
huh.
right. My husband's all about like not rocking the boat, and I'm a boat rocker. Like I
Yeah.
rock it all. I'm gonna say something. And I think that the key is like to be tactful and to be kind and to approach it like with some tact and gentleness, because nobody wants to feel like they're attacked.
Yeah.
But oh boy, I've had, yeah, just some like recent experiences where I'm like, oh, this is like so morally distressing to me that I have to say something. I can't not.
Well, and it's that respectful confrontation. That is what that
Yes.
is. It's respectful
Yes.
confrontation. And so
Absolutely.
much in society these days, we are emphasizing that second word and usually completely at the neglect of the first. You know what I mean? Like, well, this
Yes.
is this is how it's supposed to be, and I'm gonna, you know what I mean? And
Yeah.
that's what drives ad dollars and this, that, and the other, and it just kills me on the inside. Like, so
Yeah.
I'm going to touch on again like 3 4 thoughts coming into the brain at the same time, trying to work their way out of the pie hole at the same time, and it's not working. But with that, just a background, where I met Jamie was as a nurse educator at our hospital on our unit, and so we're doubling back to her career here, and she'll tell more about that. But I want to say at this juncture, I've never forgotten, Jamie. We have what's called TIPS classes, right? So classes, you're getting into a specialty. It's a specialty you've never done before. So whether you're a new grad or, in my case, a 13-year tenured nurse at the time I made this transfer, there's so many things you don't know about the new specialty you're in. And so fortunately our organization provides these TIP classes, and there are multiple classes where you're just immersed in all of these things and the key concepts and the things that are going to drive your practice moving forward, the things you're missing
Yeah.
in that. And I loved it. But I'll never forget, it was one of your first classes, and you talked about that subject of moral injury. And so if you don't mind, expound on that for a little bit. What is this moral injury you're talking about? Give examples, and how did you, even then and or now, deal with that?
No, yeah. I actually think I think that nursing is full of secondary trauma. And I don't
Mm-hmm.
actually remember giving this exact talk, but I do talk to new nurses about this, like if I'm training them, because I feel like there was a lot of that like moral trauma early in my career where I didn't feel like I could speak up because I had all of these like very tenured nurses working around me, and they didn't speak up. Like sometimes they would just be like, they were very accepting of like the power structure in the hospital, and and like the hierarchy of power that the physician possessed and anesthesia possessed. And so that, I feel like I kind of followed suit for a while and was like, well, I just have to keep my head down and I have to walk on eggshells around these certain providers, or I'm going to get my
Mm-hmm.
head bitten off, or there's going to be like some sort of abuse or vertical, like vertical abuse going on within the hospital, like
Mm-hmm.
constantly. And so that was really challenging. And I think I came to Spokane with a lot of that, like in the back of my head, knowing like, I'm going to have to like mentally work through some of these things that have happened to patients that I've witnessed and things that I felt like I was complicit in, which sounds like,
Hmm.
that sounds terrible, but like sometimes you're not the decision maker in
Yeah.
the care that's being provided, but you have to, you're providing the care, right? Like
Mm-hmm.
you're not the decision maker, but you're providing the care. And so I felt there were some cases where I just was like, I absolutely feel complicit, like I'm an accomplice in doing something that I know isn't right for this patient. And I know the reason that the provider is making this choice is because they have like conflicting things pulling at them, right? Like they're trying to balance a labor patient and maybe a sick antepartum and maybe a couple labor patients, plus they have clinic, plus they have surgery. And so there's all these different things that are pulling at their ability to make like a clarified decision. And sometimes that's really difficult. And I see physicians sometimes make decisions where I'm like, if we just considered what the patient needed, this isn't the decision we'd be making, right? Because we're trying to make decisions for multiple patients basically at once, not just this single patient. So I can give an example of that, I suppose. There's lots of these.
Sadly.
Uh, yeah, lots of these, sadly.
Yeah.
And a lot of them from like, I can remember one specific provider that like is the most traumatizing for me, honestly, in my early career. But I mean, I
And
remember,
let me, don't we all? I mean,
yes,
those that are tenured nurses, you go back and go, oh, I remember so and so. You know what I mean?
yes.
Yeah.
And that's terrible. Like, and it was a provider that had been at the hospital forever. And he was very well respected because he was skilled, but he was an a-hole like a
Mm.
lot of times. And it was really challenging to work with him. And he would target nurses. So like you didn't want to get on his bad
Mm.
side because he'd target you. He'd be like on a shit list.
Mm.
Um, but I remember going into a room with him, which I feel like this would never happen now. And definitely like this would never, like I just most recently worked at Deaconess. This would never happen at Deaconess. Like this is so insane, like thinking back that this happened. But I walked into a room with him for a patient that I had been doing an induction, like a prolonged like myso induction, multiple doses of like whatever cervical ripening we were doing.
Mm-hmm.
And she was like, hey, she was also Hispanic, which I think there was actually like a race part of this involved also, that
Mm.
like um the provider really was a, I mean, I it's just discrimination really, but like he was more willing to do more aggressive things to patients who were not English speaking. And I
Mm.
remember walking into the room with him and the patient starting to ask him questions in both English and Spanish. And I could kind of tell what she was saying to him. And he was responding back to her basically like, I'm the provider. I make the decisions. You don't get to decide. I get to decide. This is the plan. And I was
That
like,
top down healthcare, right? Like this
yes,
is
top
that
down,
old school,
100%.
like that's how it used to be all the time, way back in the day. But
Yes. And I remember like in that moment being like, oh my gosh, like this is so startling. But this is also like not the first incident that I've had with this provider. I mean,
mm-hmm.
I'd had this provider put on forceps on a patient that like wasn't consented for forceps,
Oh,
and I had to like stop him and be like, you have to tell her what you're doing. Stop
yeah,
doing that. Like you have to,
yeah,
you have to tell her. So there's so many things like that where I'm like, oh my gosh, this is so abusive. This is like, I can name what this is, and this is horrible. And you would write them up, nothing would happen. And
yeah,
so it was like, there was a complacency on the organization part as well. Um, so there's things like that, that like, that never left me. I mean, I don't know how many years that's been, but
mm-hmm.
over a decade for sure. And I still carry that experience with me thinking like, I should have stood up for that patient and said, like, back off. Like, she does get to ask questions and she does get to decide, and it's her body. And like all of the things that I feel like we're very much empowered to say now. But then nursing looked different. It
Mm-hmm.
didn't, we weren't empowered to speak up, I think, in the same way, and especially culturally on that unit. It's like I
Mm.
have such a different perspective now. But that is
Yeah.
morally distressing to me, even still. Like, I think about all the things that I witnessed or took part in, and there's things that I'm like, man, I wish I could change that, or I wish I would have done that, played that differently.
And you can get lost in the, much I use this in the topic of grief, right? You very much woulda, shoulda, coulda, if only, if you know what I
Oh,
mean. And it's a
yes.
it's a quagmire. I call it a quagmire. It
Yep.
absolutely is like quicksand. It will pull you down
Yeah, there's
quicker
no
than
way to get
anything
out of
else.
it.
Yeah. So
Yeah.
how do you avoid drowning in that? Like, how do you? Because to me, I mean, I guess the simple response is, you just go, okay, I'll be better next time. You know what I mean? Or, now X number of years out. You know what I mean? You're like, okay, I've learned enough now. I can definitely do that. I can definitely be bolder. I have less tolerance to be complicit with these things. But I mean, there's a lot of people about to enter the nursing career that are listening to this podcast.
Yeah.
What's your advice to them? How do you prevent that from occurring day zero?
Yeah. I don't know how to prevent that from day zero, because I feel
Yeah.
like day zero, you might not even be aware of some of the things that are happening because you haven't gotten a grip on the whole picture of what nursing is. And it takes a while for you to look at like the 20,000-foot view of things, right?
Yeah.
Like
Yeah.
you're just in the trenches for a while. But I think the best thing that you can do as a new nurse, when you start seeing like this, things like this that are like obvious injustices, um, is to start talking with the patient and to start talking with the provider. And it doesn't need to be a blow up in the room, but you can
Mm-hmm.
certainly pull that provider to the side and be like, hey, so this interaction that we just had, this is what I saw, this is how it made me feel, and I'm concerned because I think that this is what's going on with the patient. And you can be dead calm in that. You don't
Mm-hmm.
have to you don't have to bring a lot of emotion into it. And I think it's almost better if you just state the facts of like what you're seeing, what's happening, and how it's distressing to you. It's not always well received, but you'll feel better going home in the end of the day that you spoke up
Mm-hmm.
and said something. And I guarantee you that person will reflect on it.
Mm-hmm.
Think of every confrontation you've ever been in your life. You have never been in a confrontation you didn't reflect on. I
Yep.
guarantee it.
Yep.
So that person, just by saying those things to them and calling out the behavior, is going to probably tighten it up a little bit around you from there on out, because they
Yeah.
know that they can't walk all over you. So I would say start small in what you're speaking out against, I guess, and calling out the things that are obvious to you that you find distressing, and use your resources. Like, go to your charge nurse, go to your seasoned nurses, get another opinion, get a consensus on like whether or not something's right.
Yes.
And I think that just acting as backup, having your charge nurse help you go to bat for something, is invaluable.
Mm-hmm. And on top of that too, I'll use the old analogy. I've used this before, ask the questions, right? The advice that we've received from various honored guests: when you're in a classroom, ask the questions of your instructor, because by golly, you know what I mean? Like, just be bold, ask the questions. And what I add on to that is always like, of course, ask the question, because I promise you, even though you feel like you might be the only one and you're going to feel stupid if you ask it, I don't want to put myself out there. I'm sure everybody else has it. Guess what? There's at least one other person in your classroom, and usually several more, who have the same question and who are also not bold enough to ask that question. And so they benefit from it. So then in
Yeah.
this scenario, you're talking about, if you guarantee, obviously, unless someone's a sociopath in healthcare, and God forbid, I'm sure there's one or two out there, but
Oh, I'm sure.
sociopaths are out there. But most people, including these providers you're talking about, they'll reflect on what it is that you respectfully confronted them on. And I promise you that maybe you don't, but you're a link in a chain, because if all of us respectfully do this when the time is right, that means that provider X is hearing from nurse A, and then a few weeks later hears from nurse B, respectfully. A little while later, nurse C. If it didn't get in the first time, the second time, maybe somewhere down the line, they're
It'll
like,
change the tide.
yes, and that
Yeah.
is what we need to do. That's part of our job, right?
Yes.
Yeah.
I also think when you talk to providers, instead of directly calling them out on the thing, ask them the question. Is this does this increase the chance of infection? Is there a consequence to doing this? Is there this? Is there that? And turning it back to them and letting them answer that, because they should know what best practice is, and I guarantee you they can cite it. So if they're like, oh, well, yeah, well, then that gives you the opportunity to, instead of having like an abrupt confrontation, to direct things in another angle, right? You can just kind of steer care a little bit and be like, well, what if we did this? X, Y, and Z. Like, this is what if this was an option, and see what they respond to that with. Because I think that if they see you also as somebody who has expertise and can see the big picture of what's going on and understands the risks, they're more willing to have like pre-care discussions with you. Like, before you even go in the room, they might sit down and talk to you about like, hey, I think we should do this. We're going to go in here and talk about this. Do you have any thoughts? So I've had that a lot more, I feel like, in my later nursing career, just because of the way that I've addressed things that are concerning to me. So some providers are really good about coming back and being like, okay, well, she was upset about placing this IUPC super early because of the, risk of infection or whatever it was. So I'm going to go and talk to her about it so that we don't have to have this discussion later. They're going to try to come at you and get your opinion. So I'd say make yourself an expert in whatever field you are, and show that you're an expert. Be willing to ask the question about what the care is.
Yes. And also, in so doing, it's not a, hey doc, hey nurse practitioner, hey midwife, hey whoever, hey provider, you're wrong in front of a patient. It's not that feeling. Instead, You're saying, when you ask them the question, then you're kind of empowering them too. Like, then they feel like, okay, well, yeah, that's probably right, da-da-da-da. And they get to disseminate knowledge, and it's still kind of giving that power back, keeping that power. I don't want to say there's a power. Yeah. I don't want to say there's a power imbalance. It is
you're
collaborative.
Putting the decision making back to them again.
Yes.
To be able to like change the course. Like, now that you've brought up this concern, here's the opportunity to change the course without it being weird or confrontational.
And those providers that, and I've heard it. I remember when I was a baby nurse, and my fellow peers were like, oh, when you talk to this provider, it has to be their idea. Otherwise, it won't happen. If it's yours, it's shot down. End of story.
It's a shit idea.
Yeah, and is that horrible? Should it be that way? No, but if it's the reality you're working in, then change the rules.
Yep, exactly.
Thank you for, this is kind of, we're just kind of dovetailed into this whole moral injury thing, but I feel like it's so important, and especially when you're going into a field where it exists time and time again.
Yes, and I think it's super important also to talk to somebody that you trust about the moral injuries that you incur at work, because you will inevitably have them in your lifetime. Like, there will be things that don't go the way you wanted to, that like mistakes are going to be made, things that you wish you would have done differently, and you need to debrief those things. I would love it if we had more formal debriefs, but also like just being able to confide in somebody that you trust with the things that are distressing to you is so important.
Yes.
Like, unloading that burden.
Yep.
And it can be a therapist, but like, I call my sister with stuff all the time because she sees the back end of the babies, and I'm doing labor. And so I feel like she can really relate to the job that I'm doing and the outcomes that she sees. And so sometimes I will be like, oh my gosh, I had this thing and it was so awful, and I just need to tell somebody about it. And so I'll tell her.
Yeah. And it doesn't have to be someone in healthcare. Your roommate, your best friend, your family member who's an accountant, you know what I mean? Like, so again, the key component there, Jamie, is what you said. It's someone you trust, someone who won't violate that trust, and someone who will either give good advice or just be a great listening ear.
Just be a great listener. Yeah.
Yeah. Allowing you to offload in that regard. So, Awesome. Well, I did promise we'd finish the tantalizing career that is Jamie Clark's nursing career thus far. So,
Yeah.
5 years at the bedside. What else have you done, my friend?
So 5 years at the bedside, I went to day shift. And at that point, I kind of knew, like, I had my head above the water at that point where I was like, okay, I've been a charge nurse for like 3.5 years, maybe four. Like, I mean, was a charge nurse right away on night shift. I am interested in leadership. I'm interested in policy. I'm interested in a lot of things beyond the bedside care. And there was a position that opened up. For a Department of Health grant that our hospital held, and it was a perinatal network coordinator. There's four or five of them in the state. They each cover a region. And
Hmm.
so ours covered Central Washington. And that job entails you to reach out to smaller community hospitals to disseminate information about like statewide initiatives that are going on, and help those hospitals keep up to date with those practices, because it is really hard if you are a, a birthing hospital that does 500 deliveries a year and you're the nurse manager of three different units,
Yeah.
and there's like no A&M to help you have no assistant nurse manager to help you disseminate information. It's like all on you. So it's really helpful to have somebody come in and be like, hey, look, this is a policy, this is a protocol, this is the new work that March of Dimes is doing, this is what we're talking about at WISHA, at Washington State Hospital Association. um, and so that was what I did. So I went and visited, I think, almost all of the hospitals in Central Washington. I went and did a site visit, and not to do any sort of inspection. It was just really eye opening to see how maternity care was delivered in different facilities, because I'd only ever worked in like a pretty decent sized facility. Like Yakima does like 2,800 deliveries a year. So that's a pretty good volume.
Yeah.
And so it's a little different when you go into these small hospitals that are just doing, like maybe a couple births a week. So I would go there, meet with our nurse manager, give him information, give him my contact, give him resources. Um, I'd put together a newsletter and send it out like a couple times a year. I would go to WISHA meetings. I would go to all these state level meetings. I sat on the March of Dimes grant board. So I did all of these different things. It was like, oh my gosh, I get how Medicaid's tied into WISHA, how these different initiatives come in, why they're pushing different things through the hospital, why it's important that we have why we're doing induction consents, why we're doing this or that, why is this important?
Mhm.
And so that was really intriguing to me, because I had never really considered like, why are we doing these things? Like, who's pushing this?
Yeah.
Is this just the hospital, or is this something bigger? And most of the time it was something bigger. And our hospital was just like an early adopter of it. Like, they were just involved. Um, we had a lead physician that was really involved, like statewide with maternity care, and was kind of tied into UW's medical school. And I feel like that influenced our unit a lot.
Hmm.
So that was my job number two. I still was
Yeah.
doing floor nursing, but was doing this grant. And about a year and a half into doing that grant, I had, I was doing all these different statewide work groups. Um, but we basically were coming to a point where my oldest was going to start school. And
Hmm.
it was like, okay, we've talked about moving out of Yakima. We've talked about like moving somewhere else. We haven't really defined where we're going. We actually went to Colorado to go look at a couple places to live, which is crazy.
Wow.
Yeah, so we flew to Colorado for like a little vacay, and we were like, yeah, 2 or 3 plane rides is probably too many to get back home. That might not be a good option for us. Um, so we went up to my brother's place in Chewelah. He's a dentist in Chewelah, and we went up to his house for, I think, Christmas or something. And we drove through Spokane, and I was like, why have we never talked about moving to Spokane? Like, why was this was never on our radar? Like, why haven't we talked about this? Um, and we just got to talking, and I was like, oh my gosh, there's so many hospitals here. There's way more opportunity for my husband, who is like an industrial mechanic and a boiler operator. So like there was kind of like one gig in town that he could do to like maximize pay in Yakima. Well, that's not true here. Like, there's tons of jobs in
Right.
Spokane.
Right.
So we just like we picked up and sold our house like in 4 months. Like we were gone. So
Wow.
yeah, we like I gave notice. We picked up. I left first and took a travel gig at Deke and did a couple of like back to back assignments there. I was really nervous because I loved my unit in Yakima. I was really nervous about committing to another unit.
Yeah.
And so I did this travel job and I was like, okay, I do like it. But my husband and I were both doing shift work. And so it was kind of this decision about who's going to do the shift work now because we don't have any family here.
Mm-hmm.
And we had already struggled through us both doing nights and all of those challenges, you know. Um, and so I decided I would go to the clinic for a while, and my husband would take a night shift at a plant. And that's what our plan was. So I left
Mm.
Deke after a couple of travel assignments there, and I took a job at a clinic in the valley. And that was really, I mean, it was so interesting because I learned so much about GYN care, but I basically almost right away was like, oh, I just like there's no adrenaline reward in this job. There isn't, it's you give a lot, and I don't know if I got a lot back from it. So I kind of
Yeah.
was like, I think I need to do something else. I had already applied for um a professional development like education job at Sacred Heart. And
Mm-hmm.
so the manager of that department had been out with like a family medical issue, and they finally called me back and like hired, like I interviewed and they offered me a job, and I was like, yes, this is it. Like this is what I want to do. I want to teach. Like I can use this background that I have with like the state. Like this is going to be like perfect.
Yeah.
Um and so I did that for like 3.5 years, and in the middle of that we opened the farm up.
I remember.
And that really like changed the trajectory of my professional career.
Yeah.
Because at that point, I was taught like I was going to conferences as a speaker. Like I was doing these residency classes. I was writing like kind of opinion pieces about like best practice and stuff and putting them out on the unit and like
Mm-hmm.
doing all this different stuff. And I kind of like I told my husband, I was like, I think when I am retired, I want to do I want to be like Marine Shogun, and I want to like do all of these. I want to stay up to date on best practice, and I want to go around and speak as like a clinical expert. And like that was the trajectory I was on.
Yeah.
And then all of a sudden we had this farm that we opened and was becoming successful. And I was like, okay, I have to pull back from something.
Yeah.
So and it also became clear that I I could replace Matt's income if I chose a different position. So
Yeah.
I was doing education out of the love of doing education,
Mm-hmm.
but I was not making a lot of money doing education. I was not even making as much money as like a floor nurse makes.
Yep.
Even though I was supposed to be doing having like clinical expertise beyond, I was not
Mm-hmm.
being reimbursed for that. So that is a very hard compromise to make when you're like, okay, my husband could not work and we could be way less stressed and we could have get all this stuff done, or I could find another, you know, like I could stay in this clinical position, or I could find another job.
Yeah.
And it was like just kind of post pandemic, where you like things were starting to clear up a little bit, things felt a little bit better, and
Mm-hmm.
I decided to travel nurse. The money was still good at that point. And I replaced Matt's income, and I have ever since been able to
Yeah.
replace what Matt was making with my experience. And so I took another couple contracts at Deaconess because it was like the logical place to go. I'd already been there. And
Yeah.
so and I knew their nurse manager. So I just hit up their nurse manager and was like, hey, do you need a travel nurse? And she was like, are you looking? Like, what's happening? And I was like,
Yeah.
yeah. So I got hired on there again. And then I took a position eventually as a system float nurse for OB. The When I first got hired in, it was strictly supposed to be labor and delivery. And in the course of 3 years, that position changed a lot.
Hmm.
And eventually, it basically, they were trying to, I mean, I fully think they were trying to make the position uncomfortable so that people would take staff positions. They
I
were
see.
trying to replace travelers at one point when we had a lot of travelers, like, post pandemic. They were trying to do their own internal travel position. And so I took one of those positions, was well compensated for being flexible and working different units and working different hospitals.
Hmm.
But then it was just kind of like, I think they could see the writing on the wall that like they had enough staff, they were going to have to tighten up a little bit. And so they were changing the terms of employment. And it just at that point didn't make sense for me to stay.
Yeah.
I was offered a leadership position before I left a couple of times, but I feel like, for one, I I didn't want to manage my friends.
Yeah.
You know what I
Yeah.
mean?
That'd be so hard.
Yes, I think that's really hard. And like you see people who do manage their friends and have been, have grown on a unit and kind of like taken on those leadership positions. And I just didn't want to do that. Like I just loved the people I worked with at Deaconess, and I just couldn't, I didn't want to do that. I just want to keep those relationships like friendships.
Yeah.
So I took a travel position um in June. So I'm back traveling, and I actually think I may do this long term because it
Really?
makes sense for our farm. Yeah.
Hmm.
So I took a contract in kind of like central Washington area, and I just finished a contract there, and I'm going to re-up and take another contract there in November when the farm is all finished up, because we're mid pumpkin patch right now, which sounds like really chill. Like I think that I'm right. Like,
Yeah.
oh, you're doing a pumpkin patch. That's cute. And it's like,
No,
oh
you
my
don't even
gosh.
understand.
It feels a bit like planning a wedding for a whole month. Like
Oh,
that's
oh,
what it feels like to me. Like you have to make sure everything is like, there's just so many moving pieces, and I'm doing inventory on stuff, and I'm doing animal care, and we're harvesting pumpkins. We planted 10 acres of pumpkins this year. We just got our honey harvested, which is super late because we're pulled in so many different directions.
oh.
Um, so yeah, so it sounds cute, but it definitely makes my blood pressure go up in the fall. So that's kind of where I'm
Oh.
at professionally. I have had a lot of jobs, but it's been really good for me. And
Yeah.
the second I went back to travel nursing, I was like, oh, this is like really mentally stimulating to me. Like I have to do so much critical thinking because this isn't my home. Like
Yeah.
this is not my home unit, and I'm really having to like think about not how somebody not how I know how to do things, but like how somebody else does things,
Yeah.
because it's different.
Yeah. It,
And then also keeping that moral clarity of like, oh, this is it, like doesn't sit right with me, and now I have to speak up as a traveler, and that's a whole
mm-hmm.
nother set of issues. um,
Mm-hmm.
I wrote my first safety event the first day of my contract this year
As an outsider, quote unquote.
as an outsider with a
Yeah.
fresh contract. Yep. So
Oh.
so yeah, it's been interesting professionally, but I think that all of those things have made me grow so much.
Yeah.
I know that people stay in the same place for, like 20, 30 years or their whole career, but I mean, I think forcing myself outside of my comfort zone has made me grow a lot.
And that's what I love about you sharing your story and that journey, because I mean, listener, you have two sides of the coin right here. I have had two positions in now going on nearly 19 years, coming, well, by the time you hear this, it'll be very close to being 19 years as a nurse. I will have held two positions, both inpatient, not much diverse in that regards, but two totally different, you know what I mean, areas of nursing. And
Mm.
I'm totally like, I am obviously I'm content, but obviously not content enough to rest on my laurels, quote unquote, with that, because here I am, like I'm passionate about teaching and helping nursing students. So there's
Yeah.
always more to do and more things you want to do. But then Jamie's side of the coin, you know what I mean? You're talking. So the longest you stayed in a position was that first 5 years? Question mark.
Well, I was in that position for almost 8
Okay, so
because I
eight
did
years.
this. Yeah, but that is the longest. But I did
Yeah.
something else in the middle of that. Like it was like, I can't, I got to do something else. I got it. I
And I
can't keep
love
doing the
how
same thing.
you had referred to this career that you and I are both passionate about. You called it the diverse universe that is nursing. It's the first time I've seen it put
It's
that way.
so funny because I have no recollection of writing that, but I do feel that way. Sounds eloquent. I don't think that came from me. Uh, but yeah, it
Ah,
may seem diverse, right? Like you can
yep.
do anything with this degree. You can do anything. Like you could do sales, you could do travel nursing, you can do floor nursing, you can do admin, you could do leadership, you can do education, you can teach in so many different ways. You can consult, you could work for an insurance company, you could triage people and do phone calls all day. Like there's just so much you can do, and I just challenge people that if you're in a rut in your career, or if you find the career that you initially choose in nursing to be unfulfilling, to take the leap and try something else.
Mm-hmm.
Because don't always make, like, you don't know until you know, and that first position doesn't have to lock you in forever. And I feel like maybe this upcoming generation, there is a lot more career hopping and position changing from
Yeah.
these later generations.
Yeah.
And maybe that's part of it, is that they feel like, I don't have to commit, I can do different things. But I also encourage you to do that. It does just make you grow. And when you're
Yes.
uncomfortable, you find out so much about yourself and about your skill set when you make yourself uncomfortable.
And I'll piggyback on that. As you know, again, I was going to be a night shift peds-onc nurse my entire career, and when I recognized, you know what I mean, after over a decade of serving in that populace, that my heart couldn't take it anymore. You're terrified to make the jump. I've spoken to that on previous episodes. Would I have, but this is you're giving me a different perspective, and that is, would I have been rewarded, would I felt still as rewarding to stay in that position 100%. It's one of the most fantastic, patient populations you could ever serve. Children who are facing these uphill battles, and not just cancer, but there are a lot of things we faced on our unit. Would I have felt fulfilled and all the things? 100%. And yet, because I made that change and because I faced the terrifying prospect of teaching this old dog new tricks, I was exposed to a whole new realm of not only patients, but peers. And I mean, so many other, and now I teach OB. I teach OB, Jamie. That's a sentence. I always say often, you're going to say sentences you never thought you'd say. And that is one that definitely never would I have thought would be some sentence that would be true about me in my nursing career. So
But
do that.
can I just tell you that, like, you were such like a ray of sunshine when you came to the unit. Like I remember you dropping off a stuffed uterus to the
Yep.
unit pre starting the job, and I was like, "Oh, this guy's going to be fun. I'm into it." Like he's willing to like be like, "I'm the male nurse. I'm coming to town. Get
Yeah.
ready. Here's a stuffed uterus. I'm real excited about like women's healthcare." And I was like, "Oh, I like this guy. Like this is going to be
Oh,
great." So I felt
oh.
like it was just such a breath of fresh air that
Hmm.
like mom baby really needed it, and it was so lovely to have you like join the unit.
Oh,
It was so nice. I just felt like it, like sometimes it gets hard to be on a unit, and especially during when times are hard in life, and then you
yeah.
get somebody that you have like just such a you have a positive outlook on life, and that's really lovely, especially when you work around some nurses that you're like, oh gosh, I think that this might be your sign to move on to something that you enjoy, because right now it really feels like you don't.
Right, right. And regardless of how much you enjoyed said thing in the past, it's those things
Yes.
change. And so always that's why, and I preach it to my students, always reflect, you guys, never lose the art of reflection. And Jamie's hit on that here in her 2 episodes. Always do that evaluation, you know what I mean? Change when you need to change. Don't be afraid. Face the fears. Jamie, okay. So unless I'm missing anything, let's wrap up in our traditional closing manner, and that
Okay.
is, you picked 3 words to describe nursing school.
Yeah.
What were those 3 words, and why did you choose them?
Consuming was one of them, which is because it really consumes your life when you are in nursing school. It almost becomes like part of your identity. Like truly, I think nursing does become part of your identity, like maybe as as part of you. Like if you're passionate about nursing, it does consume you. But nursing school, it engulfs your life. Like it
Mm-hmm.
swallows you up. And that
Mm-hmm.
can be really challenging and also like really amazing. Like what a gift to be able to really dive into something if you're passionate about it. And so I kind of see that as both like a maybe a negative and a positive thing, that like it really does consume your life, but like it consumes you in such a great way where if you want to dedicate yourself to learning something, you can.
Yeah.
So and I chose inspiring, and I think that nursing school was one of the very first times where I was like, oh, this is where I want to be. Like,
Yeah.
this is what I want to learn. So many times I feel like when you're in college, you're like jumping the hoops, right? Like you're getting your prereqs done. You're checking the box of that prerequisite and you're like not really into it. Like your heart's not into it, but you have to get the grade so that you can get to where
Mm-hmm.
you want to be. And it
Mm-hmm.
was like, oh my gosh, I'm there. I'm totally there. I'm like inspired. I love this. Um, this is like just fills you up in a way that makes you so passionate. And I challenge that if you don't feel that way about nursing and you're in nursing school, to reflect on that, because if it doesn't, if you can't find passion in like what nursing looks like now, it's going to be very disheartening when you get into nursing and you have hard days. So if you are not passionate, like deeply passionate about nursing, I truly feel like you probably like nursing might not be for you, because if you don't have passion now, how are you going to have passion later on?
Yep.
And then I think my last word um, was challenging or difficult or something. You know, it's hard. Nursing school is totally hard.
Yeah.
It was really hard, but I learned so much about myself. I learned how I learned, you know. I think I learned some of that doing my prerequisites, but I really learned that I needed repetition. Um, in viewing something to absorb it. And so I would rewatch my video streams. I would rewrite all of my notes, and that wasn't typing them for me. I wrote them because that is how I digested the material. Like I needed to hand write my notes out.
Yeah.
And I mean, I don't know how. I just looked at my transcript the other day and I was like, God dang it, I got straight A's in nursing school. That's freaking amazing. Like I'm still kind of baffled by, I mean, I got a lot of A
Yeah.
minuses, but I got straight A's in nursing school. But I think it was because I was at the coffee shop every day, just like, I
Yeah.
mean, I let it consume me.
Well, like you said, with your marriage too, you talked about, kind of putting that head back up, and you're like, "Oh, hi, honey. There you are.
Hi, we're
Okay,
married.
I can devote myself again here. We're
Yes.
good."
Yes.
Oh,
Yeah, a
that's
little bit.
awesome.
So yeah, so those are my words. And I hope that I just really hope that if you're in nursing school, you find a career path that you're passionate about and that feeds you, and that you go home not every day, but a lot of days feeling like I really gave something to somebody that
Yeah.
changed their experience in the hospital, because almost every day in the hospital for every single person is one of the worst days, at least maybe of that year for them. You know,
Yep.
like that it could be the worst day they've ever had in their life. It could be the best day, but it's definitely impactful and they're not going to forget it. So I hope that you leave the hospital feeling, or whatever kind of work you're doing, like with some sort of like invigoration because of what you've done that day. And I remember that a lot in education, actually, like feeling like, man, I freaking love this job. Like I love this
Yeah.
job so much. And I would come home, and my husband would be like, this is disgusting. Like how much you like your job. Like, it's supposed to be a whole, like something that you go and do. And then you come home and you're like, oh, thank God I'm done with that. And
Yeah.
it was never really like that for me. Like I really loved education so much. I still love
Mm-hmm.
floor nursing, but I loved education. It was a really good job for sure.
And that's what I love about you. I love your passion, and that's why I was so grateful that you're like, "Yeah, let's do this. Let's do the podcast. Sounds good." So I I don't know if that's your last bit of advice, but if you had one last piece of advice that's the only thing you want, the one thing you want people to take away when they listen to your episodes, what would that be?
I hope that as a nurse, you are able to overcome or grow in your profession. And I hope that you don't lose sight of who you are and what you stand for and standing up for the things that you believe are just in healthcare. I think that's one of the biggest things.
Awesome. Awesome. And again, covered that in spades. So Jamie, thank you so much for taking time away from the animals to come talk with this animal about this very topic that we are both super passionate about.
Yes. Thank you, Eric. I so appreciate you.
Great connecting. Thanks, Jamie. Here's what's happening on the next episode of Feeding Our Young.
My time in Peru really opened my eyes, and I was like, we can make a difference.
Yeah.
We can make a difference. Seeing these people lining up outside of our clinic because they don't have any other option. And it was for things like parasites. They needed, because we had pharmacy students with us too, so we had our own little pharmacy. They needed medication for parasites. They needed medication for ear infections. They needed all of these things, and like it's the accessibility that they don't have there. And making that difference to them, I was like, oh my goodness, I can make this difference back home. Like, it just was so eye-opening that yes, this is something that I can do and want to do.
Did you like today's episode of Feeding Our Young? Want to know more about the Feeding Our Young movement? Check out our website at feedingouryoung.org. Would you like to be featured on a future episode? Maybe have Eric bring his unique brand of encouragement to your nursing students or nurses? Please text us at 509-666-5636 or email us at info@feedingouryoung.org. We're so excited to have you return to hear our next honored guest. Be sure to follow us on YouTube, Instagram, Facebook, and TikTok at Feeding Our Young LLC. Again, that's username Feeding Our Young LLC. Until next time, be encouraged and go find someone to encourage today.